Good evening, everyone. My name is Dan Faulkner. I'm the RCDSO Registrar and CEO. First, I want to acknowledge that our president, Dr. Harinder Sandhu, could not be with us this evening. He's out of the country. And I want to welcome you to the first virtual member town hall of 2024, RCDSO Connect. I really appreciate you taking time from your busy schedules to hear directly from the college. So to begin, I would like to recognize the complexity and privilege of gathering online today by sharing a land acknowledgement from the Government of Canada. We acknowledge that we are joining this meeting from the traditional territories of many nations and that these lands are home to many diverse First Nations, Inuit, and Métis peoples. I invite us all to recognize the traditional territories of the lands from which we are joining this meeting. Thank you. We build these sessions around topics that are of interest to dentists, and you'll have an opportunity to participate in a poll at the end of this session to suggest improvements and future topics for us. This sold-out session is eligible for a Category 2 CE point. You'll receive a reference code from me at the end of the session, and you will be asked for it as part of our post-event survey to verify attendance here this evening. We do these sessions to connect with dentists and to keep you informed and up to date with the college's work. This is just one way we communicate. We're also active on social media. We post regularly on our website. We send out newsletters and council updates, as well as e-blasts to the profession and stakeholders. Our Connect sessions are also posted to our YouTube channel. I encourage you to follow us on social media and subscribe to our YouTube channel to get alerts for our videos, news, and resources. So tonight, our aim is to provide you with some general updates, and then we'll dig deeper to provide some insight on the Professional Liability Program, PLP. We will also hear from professional conduct and regulatory affairs experts on how the complaints program works and how to avoid complaints. And at the end of the presentations, we'll address the questions you submitted through the event registration. With that, we'd like to get this event started by asking all of you a question. We always look forward to hearing from our participants, and to do that, we use a live polling tool called Slido. So I'm going to give you a bit of time, and on your smartphone, your computer, or your tablet, please open your web browser. You can go to www.slido.com and enter the event code as you see on the screen, 3185389. Alternatively, you can also scan the QR code on the screen to participate. And we're going to do several polls throughout the evening on a few issues. So hopefully you're set up and ready to go, and let's get started with our first question. This one's fairly easy. What drew you to this session the most? Is it news about PLP? Is it about the complaints process information? Is it updates from the college? Or is it related to the CE point? So I'm going to give you probably 30 or 40 seconds, and everyone will see on the top right the number of respondents that we have. So it looks like updates from the college is leading so far. And I'll just give it about 5 more seconds. We've got about over 90 responses, close to 100 responses. So it looks like you're very interested in updates from the college, and you'll also hear about PLP and the complaints process, and I'll talk to you more at the end about the CE code. So thanks again, everyone. With that, what I'd like to do is provide you with a few quick updates. You'll see on the screen that over 600,000 Canadians have qualified so far for the Canadian Dental Care Program. Next slide. I know that there is a lot of detail still to come, and that the associations and others are working on your behalf to really find out more details. And I also want to say that from the college's perspective, that we are absolutely interested and applauding any program that impacts or increases access to oral health care for Ontarians. This is a really important part of our strategic plan, access to care. And I know that you'll see and you're aware that providers can sign up starting on March the 11th, and many of you may be waiting to get more information. More information can be available if you scan the QR code. It will take you to the Government of Canada website, and we'll all look forward to increased access and how this will unfold in the coming year. Next slide. The college is also quite active in standards development. In fact, we are quite aware that some of our standards need to be revised. We have a call constantly for new standards. And so standards development became a key part of our strategic plan and forms one of 6 strategic projects. On the screen, you can see that there is a very comprehensive process by which we are going to be revising and developing new standards. We have probably 26 standards that are on the books. We want to make sure that it's an appropriate number, and we're also looking at priorities. So there is a process that's been used to define what are those priorities. We can only look at so many at a time. There will be extensive research involved in every standard. We will look at the evidence. We will look at the literature that's available. We will talk to experts. There will also be more than one consultation throughout a standard life cycle or the development life cycle. And that's going to take many forms. It can be surveys, it will be email feedback, it will be draft materials that you can find on social media and on our website. And that will also involve committees at the college reviewing the standards as we move through the drafting and the finalization process. And also there will be lots of opportunity for council to provide its feedback. This will occur at the point before we go out for consultation, and it will also occur at the end of the process to finalize the standard. So I hope you'll see that there's a great effort that's going into the development. We want the standards to be usable. We want them to be accessible to you, and we want them to be based on risk, that risk of harm to patients that can be prevented or mitigated by a comprehensive standard that's available to the profession. Next slide. I mentioned surveys, and you will notice in the coming months and years that we will be providing lots of opportunity to hear from you and also to hear from the public and other stakeholders. We will be surveying in the coming months on access to care. In fact, that is a survey that's out in the field already. We will be surveying on another strategic project that's trying to better understand the various forms of practice models that are operating in Ontario that will help us to understand what we need to be thinking about as a regulator. And all of these are used to help inform and shape policies and positions. We go out with surveys to really understand the input that we'll get from the multiple stakeholders before we develop our positions and policies. So the surveys are a real valuable tool for us, both before we start developing a standard and also at the during parts of the process in the middle. Next slide. I mentioned that our access to care consultation is in the field already. This is another area where we are seeking feedback to help us understand what's happening with the profession, what are the public's expectations, and it will help us to look at a standard of practice or to develop a standard of practice to really articulate the dentist's legal, professional, and ethical obligations when accepting new patients into their practices, and also to look at a professionalism guide that helps us set out those values and principles and duties that dentists have as professionals. A lot of this won't be new. A lot of it can be found in various documentation that we have on our website and as part of the college's curated resources, but some of it might be new. And we want to ensure that we provide a comprehensive effort to understand where we need to go to develop in these particular areas, and also to get feedback along the way to make sure that we're hitting the right note in terms of the standards or the positions or guides that are developed. Next slide. Many of you will already have seen our enhanced e-portfolio system. This is an incredibly popular version now in terms of the satisfaction of many of the members, where you can arrive at our enhanced e-portfolio, you can search for continuing education courses, You can upload your certificates directly. You can see a dashboard with your CE points across the various categories. I know we've also used it recently to ensure that there are reminders that go out before deadlines are due for the CE cycle coming to an end, to give you a reminder that you have so many points or you need so many points. There's lots of opportunities that we're going to explore to make this even better. And I hope that it is working for you. We did a lot of consultation with dentists, and we want to make sure that we continue to hear from you so that we can make it even better. But feel free, please, to send along your feedback as you navigate this system going forward. Next slide. And before I turn it over to our speakers, I want to talk briefly about the professional liability program. First, I'm going to do a very brief survey with Slido. So hopefully you've kept your Slido screens open. And the reason we're asking this question, and please go ahead and answer, is that recently in just before the holidays or the end of the year in late November, a few of us were at a dental society meeting and asked this question. And after 2 months of having talked about this and communicated it, there were about 25 or 28% who hadn't even heard that we were doing anything with the professional liability program. It looks here like there's another 20% or so of you. We've got about 95 or so that have responded that haven't heard about the professional liability program and what we're doing moving forward. I'm going to give you a few really rough sketch points of this. A lot of detail is available elsewhere, and I can point you in the right direction. So it looks like most people, the majority, have heard about what's happening. I'll give you a bit of an update. You'll hear from Alan, and you'll hear a little bit more from me. Next slide. The first source of information would be the Expert Review Task Force. This was a task force that was commissioned in late 2022. It worked for the first 6 months of last year, 2023, and it really focused on the benefits and the risks of the PLP program as it's operated by the college. It found that the program and its operations were efficient and effective, but it also raised a number of concerns with the risk landscape. What are some of those financial, regulatory, and reputational risks that we as a legislative college run by operating a professional liability or a malpractice insurance program? So our council and the task force determined that the status quo was not an option. Next slide. In order to really inform some of the next steps that occurred in the fall of last year, we sent out a survey to all registrants in November. That is approximately 11,000, just under 11,000 dentists. We got back about 1,600 responses, and dentists told us a lot of the areas of the program that they found were valuable, and they told us some of their concerns. You can see a few of them on the slide in front of you. There were concerns about what the cost implications might be. There was a fear that there might be some repercussions to the profession by going to a private sector insurance model. There is certainly value that's understood by the profession in maintaining a number of aspects of the PLP program, and one of those is the service offering. And it was very important to dentists to maintain a fair and reasonable cost and to ensure that there was adequate liability coverage. You can read about the survey. It's available in full on our website, but we wanted to do this so that we could understand, as we're moving to a transition process, that we maintain as much of the value as possible. Next slide. And so council directed that we begin to pursue or explore an option to transfer PLP to a third party. And the goal here is to ensure that the program continues in a way that's very comparable to how it operates now, but under separate ownership. And in order to begin a divestment process, the executive committee was delegated authority to start to look at a lot of the details and the mechanics of doing so. So now what I'd like to do is introduce our next session for this evening and welcome Alan LaChapelle. Alan is the manager of the Professional Liability Program. And as you've heard, we are in the process of a major change for the program, but in the meantime, it's business as usual. Stability for both patients and dentists will be maintained throughout the transition process. New and existing PLP cases will continue to be handled in the usual manner. So Alan will now provide you with an overview of the program, its benefits, and what happens when you contact PLP. Alan's also going to be providing some data on reported incidents in the areas of dentistry that see the most claims. Alan?
Thank you, Dan. I'm nice to virtually meet everybody who's out there in the virtual world. I'm very pleased for and appreciate the opportunity to come and speak to all of you tonight with respect to PLP. We'll be giving a little bit of an overview of certain aspects, which I'll show on the next slide. And there's a few categories. Thank you, Angelo, our tech person. So what we're going to talk about tonight is the 5 categories that are on this slide. And the first part is going to be what is PLP, what protection is offered by PLP, contacting PLP, some of the program benefits I'll summarize at the end. And I'm also going to intersperse with some data about PLP, the claims and the trends, etc. Next slide, please. So first, we're going to start with a Slido poll. And the question that we're asking is, what do you think PLP is? What is PLP? And you can see that there's 4 categories there that you can select. Are we an insurer? Are we a regulator? Are we a college program? Are we all of these? So go ahead and select what you think. If you've attended one of our presentations before, you might already know the answer, but let's see, we have about 60 responses. Most people say we're an insurer. Some people say all of these. College program, 1% is a regulator. Well, it looks like the insurer is coming out ahead. Have over 100 responses. Maybe that's a good point to cut that off, Angelo. Thanks very much. So this slide is going to provide you with the answer to that question. PLP has been providing malpractice protection for Ontario dentists since 1973. We are not an insurance company at all. We are simply a program of the RCDSO. And as Dan mentioned, the college is looking to find a partner to transfer the program to. This process we're calling a divestment. You can see that on the slide. And the goal is to maintain the program and its benefits as is, if possible, and business as usual. But please understand that the PLP program is separate from the other college departments. There are systems in place to ensure that your claims contact and what you say to PLP staff is confidential. And the program costs are included with the RCDSO fees, so you don't have to go out and purchase your liability protection separately. Now, this might change with divestment, but currently and for the last 52 years, they have been included with your RCDSO fees. Next slide, please. So as you likely know, the college's mandate is it must act in the public's interest. So the public interest link with PLP is that all dentists who are issued a license by the college have malpractice protection. So no licensed dentist is left unprotected. And this benefits the public who now have access to funds if there's a legitimate claim. And of course, it also benefits dentists who don't have to use personal assets, if they have them, to pay claims. But if you look at bullet 2 here, our philosophy with respect to a claim that's been advanced is that when there's liability and an injury, we will try and settle that case fairly, and that's in the public interest. But if a claim has no merit, we believe that professionals deserve to be defended, which we do in these situations, and we don't take the easier, softer approach of settling simply for economics. Next slide, please. So let's talk about the PLP staff. The team at PLP is a highly qualified group, and this is how the team is comprised. We like to think of ourselves as a small legal department. You can see that we have lawyers, we have paralegals, we have other administrative staff, many of whom also have legal training. And we also have a very experienced dentist on staff and a dental assistant. As well, some of the matters have to be referred out of PLP if we're not able to keep them in-house, to be handled by external defense counsel. And we have a panel of 3 firms who specialize in health law and in defending dental malpractice claims. So dentists don't have to find their own lawyer if they find themselves on the receiving end of a lawsuit. Just contact PLP. We will handle everything for you. Next slide, please. So what exactly do we do? Well, we defend, settle, and resolve lawsuits and claims. We'll jump in and we'll respond to letters or emails that dentists receive from patients or they receive from their patients' lawyers. And we also retain and instruct those external counsel that I mentioned earlier with respect to the litigation matters that are not kept in-house. So dentists don't have to do that or handle that themselves. And some of the softer services that we provide is that we'll help dentists with unhappy patients who may be threatening some kind of action or they're upset. And what we do there is that we'll provide strategic advice regarding the situation or suggest wording to be used to respond to a patient's inquiry. And we also help dentists refund patients properly. So what do I mean by properly? Well, we prepare and provide a release document for a patient to sign to ensure that ends the matter. The situation is fully resolved. And a significant amount of time is spent by PLP staff reassuring dentists about a patient conflict or giving them the confidence and the direction to handle the matter directly with the patient if it's not a situation where a PLP advisor would jump in and take over. And to be clear, in terms of our services, we do not assist with college complaint matters on the regulatory side. We're not able to do that. There is an organization out there called the Canadian Dental Protective Association. If you're a member of that, they can help you with this. There's no overlap of services between PLP and the CDPA. And the reason I emphasize that is that was a question that was submitted in advance, that whether or not there's any overlap, and there's not. The two processes are apples and oranges are completely different. Next slide, please. So this is the protection dentists have with PLP when you're a member of the college. So it's up to $2 million for each occurrence. And in addition to that, interest and patient legal costs would be paid on top. And the fees to hire those external lawyers that I mentioned earlier, they are also in addition to this amount as well. So in other words, those extras don't reduce the $2 million. If we spent $100,000 in legal fees defending you, that does not reduce the amount of compensation available to the patient if there was a legitimate injury. Now, there's additional protection or higher limits or excess, as we call it, available if you don't think that $2 million is enough for your practice or situation. And that can be purchased through the college's broker, which is Jones DeLaurie Insurance Management Inc., or JDIMI. You can purchase up to an extra $1 million to an extra $23 million for a total of $25 million, if that's what you would like to do. The college does not receive any of the revenue from this. We just facilitate its availability. So the premiums go through the broker and go to the insurer. And that's sort of done annually. And you'll probably have noticed the 2 or 3 e-blasts that came out about that recently. Now, you can also buy this excess from other sources as well, but there's no monopoly on that. Now, if you have the last bullet, one of the bullets up there is if you have a claim with PLP, the RCDSO annual fee stays the same and does not increase regardless of the number of claims that you have. Instead, claims are subject to a series of deductibles. So $2,500 for the first, $5,000 for a second, $10,000 for a third, and $20,000 for a fourth or subsequent claim. There is a 7-year tail, meaning that prior claims aren't counted in the calculation after that period of time, and they drop off and it starts over. So next slide, please. So who exactly receives this protection? Is it just dentists? Well, not quite. Obviously, dentists will receive PLP protection, but also protected, if it's named in a lawsuit, is your dental practice partnership. If your health profession corporation is named as a defendant, that would be protected through PLP as well. And your staff are all protected. Your dental assistant, your treatment coordinator, they're all named in a dental malpractice lawsuit. But the exception is it doesn't include staff who are regulated health professionals themselves. So in other words, your hygienists, your denturists, nurses, or if you bring in a physician anesthetist, and they all have their own professional liability protection and insurance. And this program doesn't need to cover those staff. And lastly, tail coverage is included for dentists who move away to practice elsewhere or if dentists retire, as long as the claims arise from treatment rendered while you had an RCDSO license. So in other words, PLP protection is always there for the treatment that you rendered. It does not stop because you give up your Ontario license. It does not stop if you change your liability providers by going somewhere else. There's no fee for this and there's no end date for this tail coverage. Okay, next slide, please. So new as of January 1st, 2024, PLP protection can be used in other provinces and territories as your malpractice protection. Now, the caveat is that you must have and maintain your Ontario license, and you must have another Canadian dental license as well. And most importantly, is the other regulator must accept PLP protection. Some do, but not all do. So I encourage you to check with PLP if you are thinking of this, and there are some other nuances that I don't really have time to get into tonight. And so if you're considering this for another province, please contact us for more information. Next slide, please. So how do I contact PLP, and when should I contact PLP? These are questions that we get often when we're out speaking. Is a reporting requirement is that you report any incident or occurrence that you think could reasonably become a claim. So what is a claim? Well, we define it as a demand for monetary compensation, a refund, or retreatment. Now, almost everyone reports to us online nowadays. Our web address is on the slide. And if you go to that address, you will see a Get Started button, and that will start the process of submitting your claim or potential claim. If your matter is extremely urgent, I suggest that you would also email us to inform us. There is a dedicated email address for the Across Canada protection, as you can see on the slide. But if you use the other one, we'll still get it. The fastest way for you to reach us is via email or the website. And if you have an existing matter, of course, you can contact your advisor directly about that, and you will have been provided that contact information by that time. Next slide, please. So how many dentists do contact us? Well, quite a few, as it turns out, as you can see from this slide. This graph shows 10 years worth of incident reports, which are claims or potential claims. As you can see, we had a record intake last year with 1,764 reports. The 2020 pandemic year sticks out like a bit of a stock market crash with 1,249 reports. And that is about 3/4 of the usual number of reports that we receive. And that kind of makes sense because dental offices were closed for 3 months. I'm sure that you all remember that fondly, or not so fondly as they anticipate. Next slide, please. All right. Okay, so what happens when you contact PLP? Well, the answer to that is it depends on the type of matter that you're reporting. And we have a few different categories, and I'm just going to explain them briefly tonight. So for precautionary matters, which we define as incidents that have occurred, but no claim or threat has yet been made, you're going to receive a confirmation of your report. You'll receive a reference number. You'll receive a contact person to reach if anything else occurs. So depending on the situation, you may also receive a call from an advisor. Sometimes we recognize that it might be precautionary, but you might still need a call. For release cases, and that's one of the soft services that I spoke about earlier. As a reminder, these are incidents which the dentist, not PLP, is making the payment. And for example, if a dentist just wants to refund a crown to the cost of a crown to a patient, the PLP can provide you with the paperwork to ensure that it's paid properly. The payment finalizes the matter. Here you will be contacted by a paralegal, a PLP paralegal, who will prepare the release document for you and send it to you for your use. Now, for the more serious matters, which we call threatened litigation, which we define as threats or demands for compensation by patients or their patients' lawyers, and for cases that involve lawsuits, you will be contacted by a PLP lawyer or advisor We will obtain more particulars about the matter, advise you about the next step, collect records, etc. And the advisor will also answer your questions, advise you of possible outcomes, and it's most likely that the advisor is going to take this matter over for you on your behalf at this point. This advisor will then be your primary PLP contact person. Now, if you just need proof of your malpractice protection, we give out 300 or 400 of these a year. Sometimes it may or may not include a claims history, and we can provide that quickly, and it's done at the intake level by our intake paralegal. And just make the request, and we can send that out expeditiously. So some tips when you're reporting that would help us process your matter and be able to assist you more quickly is please include any documents that you receive when you're submitting your report. So for example, if you've received a lawsuit or if you've received a lawyer's letter, or if a patient has sent you an estimate and said, I want you to pay for this, please include that and send it to us to PLP so that the advisor will have it and will have already read it by the time they contact you. Also, patient name and date of birth is helpful and can facilitate the process a little quicker. Next slide, please. Okay, so in the last slide, I referred to categories of reports, and I called those precautionary, release, threat, litigation, and legal actions. So this graph shows how many of these were received in each of the last 3 years. So if you remember the slide with the blue bars, and it showed you all of the reports for the year, well, this is them broken down for the last 3 years. You can see that the largest category is threat and litigation. And just to reiterate, that's threats and demands for compensation from patients and their lawyers that are not formal lawsuits. And there's a lot of requests. In fact, most of the requests for compensation are in that category. Legal actions, on the other hand, has the lowest intake amount, but they take the longest time to resolve, sometimes a few years. And that's not our fault. It's mostly plaintiff lawyers' faults or the court system fault for taking so long. They often need the most work, and they often cost the most generally. Next slide, please. Okay, so this is a Slido. Go to Slido and please answer this question. And the question is, what areas of dentistry generate the most claims? This one I usually find that dentists are very interested in this. I'm curious to see what you put up. So implants is the largest word on the slide. So oral surgery seems to be a close second. I'll say that oral surgery and surgery is the same. Implants are still the biggest category. And I can see that there's a whole plethora of categories being answered. Wow, this is a great slide. We've got bridges, we've got veneers. All of that would be under prosthodontics. Somebody says pedo. All right, we have 102 responses. That's great. Implants appears to be the largest, with oral surgery being the oral surgery is getting larger. So I think that's good. We can move to the next slide. And here is the PLP data on that question. And it's a graph of the last 2 years. You can run it longer, but not all that. Sometimes the categories change. Go back 10 years, we didn't have an implant category, for example, so it's hard to merge some of them. But for the last 2 years, you can see that the top item is oral surgery at 24%, with prosthodontics coming in at a close second, almost 21%. That includes both fixed and removable, but the removable is only about 1%. Implants are in third place at nearly 13%. And I suppose you could argue that implants and oral surgery combined could account for 37% of all the claims. You can see that endo is 12% and restorative dentistry is in 5th place with 10%. So whenever I show this slide, I always like to make the note that oral surgery does not mean oral surgeons, nor does orthodontics mean orthodontists. These statistics are for the type or area of dentistry performed, not who performed it. Next slide, please. I'm going to talk a little bit about PLP presentations. So PLP also promotes patient safety and responsible dentistry by providing risk management guidance to dentists in the form of presentations with case studies. These are hosted by various groups, college-approved sponsors, such as the ODA, regional associations, and study groups. If your study group is interested, you can reach out to PLP and make a request. We have 6 Core 1 presentations on various topics or areas of dentistry and the law. And we also have Category 2 presentations as well that are shortened, or we could customize to a particular need that you have. We are out presenting about 18 times per year, so I think that makes us kind of popular. We are fully booked till the fall, where we have a few spots left. So if you're interested or your group is interested, please reach out and we'll see if we can fill those vacancies. As well, PLP, we go out to 3rd and 4th year dental students at the 2 dental schools. We do a small communication course where we provide tips before they hit clinic. And, we provide some risk management advice on how to deal with adverse events. Slide, please. Just a couple more slides to go. And this one is just a summary of some of the benefits of the PLP program, most of which I've mentioned tonight. The first is all dentists are protected. If you have a license from the college, you have liability protection. That liability protection cannot be denied if you're holding the college license. Protection includes the full scope of dentistry. So no one is saying, there's no other entity that says, we don't want to cover that. You do TMJ surgery, we don't cover that. It's too risky. Nobody is saying you've had a claim in this area before, so that's not covered. Again, if you have a license from the college, it is covered, and the college determines what's dentistry. If the college says it's dentistry, then it's covered by PLP. Another benefit is the tail coverage that I mentioned earlier for the primary $2 million. That protection is indefinite, and it even covers your estate after you pass away. Nothing needs to be done to start this, you just have it. Excess limits do work a little bit differently, so please contact us or the college broker for information on tail coverage regarding the excess if you are moving away or thinking of retiring. But if you do nothing, you will have the $2 million, essentially. And of course, the soft services that we provide, that's a great benefit to the profession. We can help you with resolving matters and avoiding matters from escalating into claims. We give it our best shot. Doesn't always work, but often it does. The staff, very specialized staff, lawyers, paralegals, know the law, external counsel, same thing. That's another great program benefit. And of course, the continuing education with Category 1 points. And the next slide, please. So this is my last slide. It returns back to the divestment that Dan was talking about. And I just want to reiterate that nothing has changed. It will be quite some time until there is a change, and there will be plenty of notice. Claims will still be handled after divestment. If you have a claim that's being handled by PLP, if that is ongoing after the divestment, there will be an obligation by the new partner for that claim to continue. So nothing will happen there. And if you have a new matter, please continue to call. Please report to us. Advice is still being given. PLP is still open. It's business as usual in PLP. Next slide, please. And that's it. I'm finished with my section. I thank you very much for your attention. I do hope that you learned a thing or two. Turn you back to Dan. I guess. See Dan on screen. Thank you very much, everyone.
Alan, thank you very much. That was a great program overview, and thanks very much to you and your team for all the great work that you're doing in PLP. I'm going to turn now to our next presenter, Jillian Slaughter. Jillian is the Director of the Professional Conduct and Regulatory Affairs Department. Jillian's going to provide some insights for you about why we investigate, on the complaints process itself, and hopefully on how to avoid complaints. Jill?
Thanks so much, Dan. Much appreciated. I'll give slides a moment to come up. Good evening, everyone. It's my pleasure to be joining you today. And in the next sort of 15 minutes or so, I'm going to try and share with you information about complaints and how to avoid them. Next slide, please. Today, we're going to go over why does the college investigate complaints. I'm going to give you a few details about college investigations. And then the meat of this presentation is going to be about how to avoid those complaints. Next slide, please. And we'll just skip one more, please. Thank you. So why are we investigating complaints? Well, it's the public mandate of the college. By law, the college must investigate all complaints that are received. There are a few limited exceptions. For some low-risk complaints, the college can resolve them through an alternative dispute resolution program. It's our resolution program. Complainants can also request to withdraw their complaints, and if registrar approval is given, they can be closed. However, this is rare. Complaints that are made in bad faith, that are vexatious, maybe abusive process, they can also be closed at the direction of a committee called the Inquiries, Complaints, and Reports Committee. You're going to hear me refer to it as the ICRC. And this category of exception is also very rare. The thing to remember is that the college is responsible for holding registered dentists accountable for their conduct and their practice through the complaints and the investigation process. Next slide, please. And we'll do one more, please. I'm going to give you a quick overview of the usual investigative steps that are involved. As you can see from the slide, most complaints are received using our online form, or they are received by email. We have an intake group, and what they're doing is reviewing it to make sure that it meets the requirements of being a complaint. Namely, it has to be about a dentist registered with the college. It has to relate to the dentist practice, and it needs to be from someone who intends to complain. At that point, once we've established that it's a complaint, the college is going to confirm the concerns with the complainant, and then the dentist will be notified. The largest part of the investigation is the process by which documents are obtained, persons are interviewed, and responses then, of course, are received from the dentist. As you'll see from the slide, dentists are always given an opportunity to respond to a complaint, to submit materials if they wish, and anything they would like the college to know in response to that complaint. Next slide, please. This slide gives you a very quick overview of some key differences between that complaints committee, the ICRC, and the discipline committee. As you can see, there's some similarities in that they're composed of dentists and of laypersons. These are public representatives who have been appointed by the government. The role, though, is where the distinction really is. The role of the ICRC is to review and to make decisions about investigations. Other than the exceptions that I just mentioned to you, they are looking at about 100% of all cases that are investigated. The review type is also a distinguishing point in that the ICRC conducts documentary reviews. It does not receive live evidence. And what's common to both committees is that there are decisions that are issued in writing to the dentist and to the complainant. A couple of key features that distinguish the discipline committee: it only receives things through the complaints committee, through the ICRC. And there's only about 1% of cases that have been investigated by the college that result in a discipline proceeding, in a discipline hearing. It holds formal hearings. It receives evidence, documents, real evidence, and testimony from witnesses to be able to make decisions related to the concerns that were put to them by the ICRC. And as I said earlier, decisions are issued in writing to the dentist as well as to the complainant. Next slide, please. One of the things I'd like to tell you about briefly is the resolution program. There's some matters that are eligible. They are typically low-risk matters that are put through to that program. The college determines which matters may be referred to the program. And one of the key pieces of this is that the parties, both the complainant and the dentist, must consent in order to be able to participate. And they can withdraw their consent at any point during the resolution process. Almost all the outcomes to the resolution program result in a resolution, and that resolution is reviewed by the registrar or his delegate to make sure that it is appropriate. The timelines are a little different than with investigations because matters that are sent to the resolution program are usually achieved within 120 days of being referred to the resolution program. If you want more information, please see our website at rcdso.org. Next slide, please. So let's go back to those ICRC decisions. I'm showing you in a pie chart here the fact that there are many types of decisions and they are categorized here by risk. And so you can see that the green portion of the pie chart is the vast majority, nearly 50%. And that shows that the majority of complaints, majority of investigations conducted by the RCDSO result in no action being taken by the ICRC. There's 28% that are low risk. That means that there's some advice and recommendations or a remedial agreement that may have been issued by the committee. You'll also see over on the right-hand side that when it comes to those frivolous and vexatious matters, about 1% of those do not result in any action being taken by the committee. And in fact, they're not investigated. And 6% result in a resolution being achieved through that resolution program. Moderate risk means there's a more structured education program that is issued by the committee that dentists have to complete. Or it could be that a caution has been issued and then a panel of the ICRC will meet with that dentist to discuss their concerns. The last category is high risk. That means less than or about 1% of cases are referred to discipline. And that you can see is borne out in the 2022 stats. If you're interested, you can see more at RCDSO's 2022 annual report. For all of these matters, the ICRC uses a risk assessment framework to evaluate the investigation. And it is paramount that they are always considering the degree of risk to patient safety. Next slide, please. This slide shows you our case volumes for the last 5 years, from 2018 to 2022. The blue bars show the number of investigations that are received in a year. And you can see that that number varies from the 500s up to 725 cases in 1 year. The orange bars depict how many decisions were made, issued in that year. And as you can see, in 2022, that number went up significantly to 892. The reason is that for the past 2 years, we have been trying to streamline our processes. We have been trying to remove unnecessary steps, avoid duplication. We have also been trying to get cases to the committee faster, and we are producing, we think, better decisions. The bar chart thus shows that effort. And the college did the same in 2023. There were far more decisions that went out than were received in the year. It means we're getting faster. And the next slide illustrates that point a little bit more. Here you'll see investigation timelines. We have been really working hard to try and make our investigations faster. So as of December of 2023, the timeline for average timeline for investigations was 220 days. That's investigation time. You can see that we sliced off 90 days of investigations since December of 2021. As you can imagine, some cases proceed a little bit more quickly if the issues are straightforward, and of course, if the parties are timely in responding to requests for documents and other information. Additional time is required for the ICRC to receive the materials, review them carefully, and then to deliberate, as well as then to issue their finalized decision. So at this time, we're looking at average decision time and investigation combined to be around 11 to 12 months. And we are continuing our efforts to make them shorter and shorter. Next slide, please. So here's the key issue that I think many of you are interested in hearing about. What are the themes of the complaints and what can you do about them? So pulling from our 2022 RCDSO College Performance Measurement Framework Report, I am showing you here that the majority of the concerns raised by complainants are about competence and patient care. There were 792 such themes in complaints that year. But where we're going to be spending most of our time in the time remaining is about communication, billing and fees, record keeping, and professional conduct and behavior, which you can see numbered from 102 to about 328 such themes in the complaints. There were other themes, of course. You can see there's advertising. There were also harassment and boundary violations, some instances of sexual abuse of patients, and intent to mislead, including fraud. Should note that NR means not reportable because the numbers were quite low. And you can see that there's a significant drop off from theme number 6 compared to the ones above. So let's focus our attentions on numbers 2 through 5 in the next slide. And if I could get you to go one more slide, please. Thank you. So key pieces for dentists to be aware of then are the need to communicate and listen. We see so many complaints from patients where they did not feel that the dentists were listening to their concerns. So it's important that dentists talk about why a treatment is necessary or not necessary. We know that conversations sometimes can take longer, but they don't really need to take a long time. And they can make all the difference between a patient leaving an appointment, feeling like they've been heard, that they understand the treatment plan and the recommendations for their care, versus a patient who leaves because they feel unheard, they feel disrespected. Another piece is patients really don't like it and complain about when dentists are looking at their phone or at the computer rather than talking to them. And so we encourage you to make eye contact when you are speaking with your patients. The other piece is communicate clearly, use concise language. Please remember that Ontario is a multilingual society, and many of us speak English as a second language. Many Ontarians did not study dentistry, and as such, it's helpful to avoid jargon, to use plain language when you're speaking with patients. It's also important to keep your tone respectful and empathetic. Patients also like it when you use the name and the pronouns that they have asked you to use. And a key thing for dentists to remember is to respond in a timely way. This is especially the case when patients are asking for things like copies of their dental record. Patients who have to ask multiple times for their dental record are far more likely to make a complaint. The last point I'll make on this slide is that it's important for dentists who may be dealing with patients who are expressing complaints or concerns to them to consider dealing with the issues themselves rather than delegating it to others. Patients are far more interested in being able to resolve and discuss the complaint with you directly. Next slide, please. Talking about professional conduct is something that I find that I spend a lot of time with my staff. And I think it comes down to 3 main things on this slide. First of all, it's important for dentists to be respectful. The college receives lots of complaints because patients feel disrespected. We acknowledge that you're busy, but you have to be mindful that patients are invested in their health, their time, and their money. They might be scared. They may not understand. Patients need respect. And so please take the time to engage with patients so that they feel heard and that you've taken the time to understand them. Similarly, kindness does count. It's a really good thing to be courteous and to be kind because in our complaints, that matters to patients. The main part I want to spend some time on here is about maintaining professional boundaries. I can't emphasize this point enough. Dentists are professionals. They have a fiduciary duty to their patients. And let me just explain fiduciary. It means trust. And a person with a fiduciary duty has a legal obligation to maintain that trust with their patients. So you have that duty as a dentist to your patients, and you have to act in their best interests. So here's some tips. Avoid the following. Don't accept gifts from patients or their families. Avoid engaging in excessive self-disclosure to patients. Don't engage in financial arrangements with patients like personal loans, mortgages, or investments. Avoid according any kind of special treatment to patients. In terms of social encounters with patients outside of work, avoid them. And try not to interact with patients through social media or personal profiles. And the last points are crucial. Dentists must avoid having any kind of sexual language with patients and developing sexual feelings and relationships with patients. I'd like to suggest that you can become more familiar with these kinds of things by reading our practice advisories, and you'll see them listed on the slide there. Next slide, please. A key piece for dentists to also be aware of is the importance of informed consent. And let me just outline this really quickly. A patient has to have a clear understanding of proposed treatment, the material risks and benefits, the reasons for the treatment, the costs, and the alternatives to proposed treatment. In other words, informed consent is not just a signed paper by a patient. If you do not have these components, you do not have informed consent. So take time, refresh your knowledge of informed consent, and you can certainly do so by reading our practice advisory on informed consent. Next slide, please. In the interest of time, I'm going to be really quick with this one, but I will say there are a number of different matters, as you can see on this slide, that relate to billing and fees. And I've tried to give you a quick summary of what they are. These are things to avoid. Billing for services not rendered is a big one. Billing for procedures already included under a different code. Submitting inaccurate procedure codes. Claiming incorrect units of time, like billing 3 units for scaling when the treatment was less than 38 minutes. Submitting claims with inaccurate treatment dates, like submitting claims with procedure codes before treatment was actually rendered. Submitting claims prior to the date of delivery or insertion, like billing for crowns on the day of preparation rather than on the day of cementation. Up-down coding means claiming for tooth 4-6 MODBL, but only when an MOD restoration was placed. Billing for services under another plan member when insurance limits have been reached should be avoided. And above all, avoid falsification of records. Next slide, please. So dental record keeping is my last slide. And I just want to go over this with the participants tonight, because dental record keeping, we all realize, can feel like a chore, but it is really important. In the blue square, you can see that records need to contain medical and dental history. They need to have that clear assessment, diagnosis, treatment plan, and details about follow-up care. And they need to have details about informed consent discussions. They are necessary. As you can see in the green square, we outline the reasons why. They help provide quality health care. They allow for continuity of care. And you need to be aware that these are quasi-legal records that belong to the patients. You are a custodian that has to keep them accurate, complete, and make them current. And lastly, I'll say that records help if a complaint is received by the college. If they are accurate, concise, and current, they detail what occurred. You should also be documenting difficult conversations that you may have with patients or others. And the reason is that without a record, the ICRC cannot fully understand what happened. And that can be a very difficult situation for the ICRC in terms of trying to put together records, hear accounts, get witness testimony and evidence before them in documentary form to be able to make a decision. So you will be helping yourselves if you keep your records accurate. I just want to say thank you very much for the opportunity to speak with you, and I hope you have a great evening. Back to you, Dan.
Jill, thank you very much. Some really great tips there at the end for members of the profession. We all know that the complaints process can be and is an intimidating process, both for the profession and for the public. And it is often a stressful time for everybody involved. So it's so important to us at the college that we're transparent about what happens, how it works, the time it takes, and of course, how to avoid it in the first place when possible. I know we're at 8 o'clock. I'm going to ask you to bear with me for a few more minutes. I want to just turn now to a few questions. There are 3 questions that we want to cover. We had a number of questions on PLP, and I think most of those were answered by Alan in the course of his presentation. But there are 3 that I thought I would just briefly go through, and they will appear on your screen. First question is, since PLP is becoming a separate entity, how will future complaints be handled that occurred prior to the separation from the RCDSO? Will there be a statute of limitations? Tail insurance that's required to be paid? What will happen with that? You heard a little bit about that with Alan in terms of the current process. Stability for patients and dentists will be maintained throughout the transition process. New and existing PLP cases will continue to be handled in the usual manner. And once a third party has been selected, additional information will be provided to all registrants. We're planning on a 12-month notice to the profession prior to any transfer. The college is looking for a new owner that will provide indefinite tail coverage for dentists if they move to another jurisdiction to practice, if they retire, or to their estate if they pass away. Next question is, where will PLP go if separated from RCDSO, and will there be any additional fees for dentists? It's a bit too early in the process to know what the new owner will charge for liability protection. One of Council's expectations for the new operator is that the cost be fair and reasonable. It's unlikely that the program would be housed at the RCDSO building under the new ownership, though that too is a little bit too early in the process to determine. Next question. Can we get an update on your consideration of options for divestment by the RCDSO of the PLP program? Council asked staff in December to begin the procurement process under the guidance of a review group, and that's been established by the executive committee. There's still a lot of work to go to plan the process, but there will be a report on progress to date since December that will go to Council in March 2024. You can tune in, of course, to that live streamed meeting, but we'll also report it in Council highlights at the end of March. I want to take this opportunity to thank both Jill and Alan for excellent presentations. Both of you have provided information that will be useful to dentists in their day-to-day practice. Your expertise, as always, is appreciated. And as always, if you have any practice-related questions, don't hesitate to reach out to staff in the college's practice advisory service by email at practiceadvisory@rcdso.org. You can also follow the college on social media to receive our latest news, updates, and resources. As I mentioned at the start of the session, for the CE credit, you will need a reference number for the post-event survey. It's on the screen now, 20240228. In the survey, we'll also ask you how we can make these sessions better and how we are doing as a college overall in ensuring transparency of our work. We want to know what we can improve on so that we can support you and the care you provide to patients. Our next college newsletter will arrive in your mailbox in March. I encourage you to read it and get more details on what we're doing to meet our mandate to serve the public interest. Thank you very much, everyone, and enjoy the rest of your evening.